Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in this Swasthavritta lecture, which is taking place on the 22nd of October 2023. Today, we are going to discuss something basic concepts about the Ahar or the food concept in Ayurveda. So, without wasting the time, let me tell you very important features of this topic. But before that, please let me repeat that please open your notebooks of Swasthavritta. Please, in the index, you write down the serial number, the date 22nd October, then write down the today's topic. For example, first I will dictate you the today's topic. So you can write down in the index as well as on the inside. Please give the page numbers. My dear friends, always check each and every day whenever my lectures takes place, before and after, you must go through the question papers that I have already discussed regarding the paper 1 of Swasthavritta. Paper 2 I am going to discuss after few days. First we are discuss the questions and then we are taking some important topics related with those questions. Our target should be examination point of view first, and those examination question papers are not only useful for the university examination, they are useful, but in the practice also, these points are very, very important. Okay, so you always see the question paper. If you find any question little bit difficult and want to get knowledge from the Professor Deshpande, in the comment box, please write down, sir, take this question of Swasthavritta. So I will give the priority to those questions which I get from the comment box. Okay, so let us start to discuss something about Ahar. So what is Ahara? Anniyate iti annapanadi sarva. Okay, that means whichever we take inside, it may be the solid, it may be the liquid, but Ahar, to take inside the body, that is Ahar. Even I will say Ahar word can be used for solid food stuff, liquid food stuff, and even oxygen. Pranadravya, that is also our ahar. But for the normal sense, we here consider ahar as a solid and liquid food. The most important, here you can see, anniyate iti ahara, anna panadi, adi means etc. Anna, pana, write down, pana, beverages, liquid food, water, buttermilk, curry, 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 fruit juices, everything, whichever buttermilk, liquid you feel, soups, these are all in the liquid category. Even Ayurvedic concept of soup, you know, Yavagu and Yusha. Yavagu and Yusha. Please write down these words. Yavagu, Yusha. These are important for Panchakarma also. My dear friends, this food concept is so important in your practice. You can become Ayurvedic dietitian. Please write down Ayurvedic dietitian, diet consultant, Ayurvedic. Yes, because in nowadays, in all the hospitals, big hospitals, at your place, at your city, there are hospitals which give food from the hospital as per the necessity. For example, diabetic food, it means anti-diabetic food. If the diabetic patient is admitted in the ICU, the dietitian came, modern dietitian. She discussed with the patient and she advised some things. Protein, carbohydrates, fats, calories, this and that, vitamins and minerals. But Ayurvedic dietitian can also get started with two things. Please remember, Ayurvedic business person, Ayurvedic businessman can start Ayurvedic restaurant. Please write down Ayurvedic restaurant. When I worked in the foreign countries for 20 years, in the Spain, we have the Ayurvedic restaurant. It is not only vegetarian, but we have the Vata type of the food for the Vata Prakriti people, food for the Pitta Prakriti people, food for the Kapha Prakriti people, food for the Rasa Hina Sarata, food for the Rakta Hina Sarata. Yes, on the basis of Prakriti, on the basis of Sarata, you can advise the food. General rules are also there. Okay, so let us start to discuss about Sarvam idam panchabhotikam asminarthe. Can you see the cursor? Sarvam idam, all the foods in the universe, all the elements. It may be the food, it may be the other things. Panch Mahabhut, Prithvi, Aap, Tej, Vayu, and Akash. So, superiority and importance. Arogyam, Bhojan, Adhinam. Can you see here? Now, I am going to tell you about the importance of Ahar. See, I have marked those things. Concentrate on those things. Okay. So, what is that? Just if possible, I can raise little bit size more. Yes, I think this is more better for your understanding. Can you? It is more clearly seen. Previously, it was small. Now I have made big. Arogyam bhojan adhinam. Our health is depend on the food. I will say health and disease both are depend on the food. If you take the proper food, you are healthy. If you are taking the improper food, you are unhealthy. So both the things are depend on the food. Remember those things. Okay. It is possible to make a person disease free with just proper diet. Please write down one word: pathya, apathya. Pathya, good things for the disease. Apathya, bad things for the disease. For example, if the person is having complaint of acidity, hyperacidity, amla pitta, what is the pathya? He should consume milk more, milk and rice, milk and chapati, the white gourd vegetable. That is better for him. But if that amla pitta, acidity patient, this is a pathya. What is apathya? Eating spicy food all the time, green chili with the vada pav. That is a bad thing for the amla pitta. So I have given one only example. In your examination, you are also asked in the previous question papers, write down the diet plan for diabetes mellitus. Write down the diet plan for hypertension. These are the questions they have already been asked. So be careful. In all these lectures, you remember Dr. Deshpande will give you the guidelines, but self-study is most important because the portion is so vast that I cannot complete each and every topic over here. Okay. Now, functions of Ahar. What are the functions? Prenanam, instant energy with the carbohydrates. Prithvi, Jal, Mahabhut, Pradhan, instant energy. When we chapati and rice, we get instant energy. Sadhyo Balavardhak, our strength will be increased. Deha Dharana, all the dhatus, Rasa, Rakta, Mans, Med, Asthi, Majja, Shukra, they will become Uttama Sara Dhatu, and that's why you will get more here, Ayu, Dirghayu. And also quantity and quality of life will be better. Utsaha, energy, smruti, good memory. So food is not acting only on the physical level. Remember, food is acting also on the mind. It is a common phrase, you are what you eat. You are what you eat. If you are eating sattvic food, you can become sattvic. If you are eating rajasic food, spicy, chili, stale food, you can become overactive. If you are eating tamasic food, alcohol, red meat, then your mentality become tamasic, violent, cheater, robber. So these can happen with the tamasic food. Sattvic food, rajasic food, tamasic food. Okay? So, Ayu, Utsaha, Smriti, Oj. Very important. Oj is related with the immunity. Vyadhi, Pratikar, Kshamata. Agni Vardhak. Your metabolic process will be good. Liver will work very fine. Liver is the biggest factory in our body. Next. Slowly we will go further. I will mark for you. Now I am discussing some classification. This is always asked in the examination. Write down the Vargikaran. Aharache Vargikaran liha. Ahar ke Vargikaran ke bare mein likhiye. Write down the classification of food according to Ayurveda. Of course, there is according to modern also. We will going to see. On the basis of Ahar Tattva, one type. That is a food, is energy. On the basis of source, that is Yoni Bheda, Sthavar and Jangama. Organic and inorganic. Salt is inorganic. Or vegetables are organic. Okay. On the basis of prabhava, hitakara, ahitakara. If the pitta prakriti person is taking milk, hitakara. If pitta dominant prakriti takes the spicy food, ahitakara. Okay. On the basis of virya, ushna virya, shita virya. All the katu means spicy, katu, amla and lavana are having ushna virya. But madhura, sweetest, tikta and kashaya are shita virya. Okay. On the basis of usage, bhaksha, leya, licking, ashana and pana, drinking water. So bhaksha, leya, ashana and pana. On the basis of panchamahabhuta, some are the parthiva food stuff. Like for example, if you take the soya bean, that is parthiva, which will black gram. Then if you take some, for example, all the liquids, curry and the soups, that is apya. If you take the kitchen spices, that are taijasa. If you take the food stuff like popcorn, bakery products, that is vayavi and akashi. Okay. Then on the basis of shadrasa, madhura, sweet, amla, sour, lavana, salty, rock salt, katu, spicy, tikta, bitter, and kashaya, astringent. You have to remember the shadrasa functions for all the time. In Ashtanga Hridaya you have learned. Please open that book of Ashtanga Hridaya and remember all the what you can say, the uses of the shadrasa and atiyoga lakshana. When you consume more, what will happen? Ashtavirya, Shita, cold, cooling effect. Ushna, irritating effect. Snigdha, fatty food. Ruksha, dry food stuff. Guru, heavy to digest. Lagu, easy to digest. Mrudu, soft, like our koshimbir. What we do, porridge, PORRIDG. Nachnichi kheer, gavachi kheer, they are soft. And tikshna, all the Punjabi dishes, Kolhapuri tamada rassa, misal, tarri, this is all the hot. On the basis of Gurvadi Guna, you remember the shloka of 20 attributes for the dosha also. Guru, Manda, Himas, Snigdha, Shlakshna, Sandra, Mrudus, Sthirha, Gunaha, Sasukshma, Vishadaha, Vimshanti, Saviparyaha. My dear friends, please refer your books and ha shlok paठ करा. ये श्लोक बिल्कुल ध्यान में रखिए. गुरु मंद हिमस स्निग्ध श्लक्ष्ण सांद्र मृदु स्थिरः गुणाः ससूक्ष्म विशदाः विंशन्ति. Vinshanti means 20. Saviparyaha. In this shlokas, only 10 properties are mentioned and opposite to that 10. Now, Charak classification of the 12 groups that we are going to see. Here I will just take the screen, adjust the screen for your understanding, and then we will go further. Just relax, just relax. Now here, my dear friends, here. You have to remember these names, classification of Charak, very important for the oral. Shuka Dhanya, Shami Dhanya, Mausa Varga, Shaka Varga, Phala, look here, Phala Varga, Harita Varga, Madhya Varga, Jala Varga, Dugdha, Ikshu, Pratanna, Ahar Upayogi Varga. But in these, the different things are coming, and you students have to make your notes from your purchased textbook of Swasthavritta, which are Shukadhanya. For my dear friends, Shukadhanya are the grains. Please write down. Shukadhanya, here. Wheat, please write down. Wheat, rice, jowar, bajra, maize. Shukadhanya, Shukha, monocotyledon. Shamidhanya, pulses. Green gram, black gram. Turichi dal, mugachi dal. Turki dal, मूंग की दाल. Shamidhanya. शिम्बी धान्य बोलते हैं उसको. ठीक है, ये हर एक की प्रॉपर्टी आपके बुक्स में रहेगी, उसके आप नोट्स बना दीजिए. ठीक है, कि ओरल को कौन से भी द्रव्य पूछा जा सकता है आपको. मांस वर्ग का मतलब होता है ऑल द मीट प्रोडक्ट्स, MEAT. सो व्हाट इज रेडी मीट? You should know it. What is the different types of the meat in Ayurveda? They have also mentioned, but nowadays you can also find different types of the non-vegetarian food. You have to write down all those things. Then Shaka Varga, all the vegetables. Phala Varga, fruits. Harita Varga, green leafy vegetables. Madhya Varga, different types of liquor or alcohol, Ayurvedic style. Sura, Mand, Peya, Vilepi, whatever, Kharjura Mantha. There are different. I will discuss whenever the time permits. Jala Varga or the liquid things, especially water. Okay. Dugdha Varga, milk products like milk, ghee, butter, buttermilk. Ikshu Varga, from the sugar cane. Ikshu is a sugar cane. Kritanna Varga, different samskaras, processed food, fried food, then fermented food, then steamed food, baked food. Are you getting my point? Ahar Upayogi Varga. The students don't able to tell this Varga. Ahar Upayogi is nothing but the spices. Please write down. Ahar. Whenever you prepare the food, Upayogi, which you use kitchen masala, masala, spices. All the kitchen spices are included in the Ahar Upayogi Varga. Next, we will go further. Ahar Vidhi Vidhan. Very important question. Actually, there is a basic thing in Kriya Sharira subject, first year BMed. Ashtau Ahar Vidhi Visheshayatana. Please open your Kriya Sharira book of Deshpande. Ahar. Write down. Ahar Vidhi Vishesha Ayatana. Ashtau means 8, 5 and 3. Ashtau Ahar Vidhi Vishesha Ayatana. Ashtau Ahar Vidhi Vishesha Ayatana. Ashtu 8. Prakriti, Karana, Sanyog, Rashi, Desh, Kal, Upayoga Samstha, Upayokta. Sir, slow. Yes, I will repeat. Please write down. Prakriti, Karana, Sanyog, Rashi, Desh, Kal, Upayoga Samstha, and Upayokta. In that 8, whatever Upayoga Samstha, mark underline, that is Ahar Vidhi Vidhan. The rules of eating food. Please write down. What is Ahar? Here, Ahar Vidhi Vidhan. Rules of eating food. For example, 2 times in a day, morning and evening. One should take food after digestion of the previous meal and when he feels hungry. That is most important. But Ayurveda says another thing. Ushnam Ashniyat, Snigdham Ashniyat, always warm, little bit anxious with the ghee, with the milk, with the water. Ushnam Ashniyat, Snigdham Ashniyat, Matravat Ashniyat. Nati Drutam, Nati Vilambitam, Ajalpan, Ahasan, Tanmana Bhunjit. You have to make a concentration while eating. Not with the TV, not with the mobile. No, that is not good according to it. With the driving, on one side, car drive and sandwiches. Foreigners. Good, not good. Okay. Rules regarding the quantity. One should take a food at proper quantity according to the Agni Bala, according to the Prakriti. Tikshna Agni. They cannot tolerate the fasting. They can eat 4 times in a day. Breakfast, lunch, middle snacks, and evening dinner. But Mandagani, Kapha people, they can eat only 1 time. That is only sufficient for them. Visham Agani, Vata, Visham Agani. Sometimes they are hungry, sometimes they are not. So accordingly, they can eat. Next, we will go further. One should avoid. Can you see here? I will take slowly up. No formality. We will be for you people. Okay. Can you see? One should avoid Adhyashana. Intake of food before digestion of the previous meal, that is called as Adhyashana. Vishama Ashana. Take intake of the less or more food at irregular time. That is Vishama Ashana. Vishama is odd. Samashana, proper, perfect. Intake of wholesome and unwholesome food together. Oh, I am sorry, it is not the proper, it is improper, it is a pathological, it is not correct. Samashana, mixing 2 different types of good and bad food together, that is also not correct. Okay. Dvadasha Ashana Pravicharana by Sushrut. Very important. Dvadasha Ashana Pravicharana. Please write down. Simultaneously, you can take a snapshot, make audio recording. Sushruta has explained 12 types of ahara according to Agnibala, according to Arogya, according to Roga, etc. He explained Shita, Ushna. Cold and hot effect on the body, not only physical temperature. Hot tea is also hot, I know, but hot milk is not hot. Huh? So hot milk is not hot. What is that? Hot milk by temperature, physically it is hot, but effect on the body of milk is always cooling effect. Milk will not irritate to your body tissues. Milk will not irritate to body tissues. Remember. So these Shita, Ushna, these properties are not only physical. They are according to the functions they do in the body. Karmuk, Sanskrit word, Karmuk, according to the effect on the inside the body. Not only physical temperature. I hope you are getting. Another example. Hot milk is not hot, that I have mentioned. Freezed, chilled chili is not chilled. Chilled chili is not chilled. Chilled chili is not chilled. Even if you keep the green chili in the freeze and take that freezed green chili and eat, it will not make a cooling effect. Chili, as per its original nature, it will always irritate your body tissues. So this is must understand the effects on the basis of what it will do when you take inside the body. It's not only physical. They are karmuka according to the functions. Ruksha, drava. Ek kal, dvi kal, aushadha yukta, matra hina, dosha prashamana. And vrityartham, according to psychological effect, vrityartham. So these are the 12 points of Sushruta. Remember, 12 points of Sushruta, Dvadasha, Ashana, Pravicharana. Maybe for SAQ or LAQ it may be asked. Next, just few minutes back, I have explained this term. Do you remember? Ashtau, Ahar, Vidhi, Visheshayatana. Here are the names. Prakriti, nature of the food. Karana, method of processing. Steamed food, fried food, baked food. Remember these terms. Sanyoga, combination. Incompatible foodstuff. Viruddha anna. Mixing of the fruits and the milk together. Not good, not good. Milkshake, not good. Shikrana in Marathi, Maharashtrian food, not good. Are you getting my point? Viruddhahar. Rashi, quantity. Ayurveda says, imagine, just imagine, and make the 4 parts of our abdomen. Imagine is not you have to cut. Imagine in the mind. 4 parts. 2 parts. 2 parts. Solid food. 1 part liquid food. And 1 part, keep it vacant. Keep it vacant for the movements of Vata dosha, peristaltic movements. Again, how to decide the matra? How to decide the matra? How should one take? Imagine the 4 parts of the abdomen. 2 parts, 50% of your food should be solid food. 25% food should be liquid food. Maybe water, maybe buttermilk, maybe fruit juices, maybe curry. And 25% keep it vacant for the peristaltic movements. This is, I am talking about Rashi. Rashi means matra. Desha, your Prakriti, Vata, Pradhana, Prakriti, Pitta, Pradhana, Prakriti is also Desh. And where you are living, geographical, whether you are living in Bombay, whether you are living in Rajasthan, in the Nagpur, in the Chanda Bhandara, where Assam, where you are living, Jangal, Anup, and Sadharana Desh. Jangal, Anup, Sadharan Desh. This is also Desh. Kala, time. Proper time. At 12 noon, you have to take the lunch because Pitta Kal is dominant. If you take the food in the midnight, it is called as a Rakshasa Kal. Oh, so what is that Rakshasa Kal? Very bad, very bad. Rakshasakal. Okay. Upayoga Samstha, that is Ahar Vidhi Vidhan. Ushnam Ashniyat, Snigdam Ashniyat, Matravad Ashniyat. Upayokta. Upayokta. Who, the person who is taking the food is called Upayokta. My dear friends, let us move for the next page. Okay, I will move again my cursor over here. Okay. So, here you can see the Pathya and Apathya Ahar. Marking is very nice, looking very nice. Pathya, these are the good. Shashtika Shali. Shali is a rice. Shashtika, which is grow within the period of 60 days. Shali Shashtika. Shali Shashtika. Rice growing in the 60 days. It's good for the health. Raktashali. Mudga. Green gram. मूंग की डाल बोलते हैं ना, मूंग की डाल, ग्रीन ग्रॅम, मुगाची डाळ मराठीमध्ये. गोधूम व्हीट, गहू म्हणतो आपण, गव्हाची पोळी, चपाती. गोधूम व्हीट. Mahendra Jala is not implemented nowadays, is not. Sando, yes, we are using sometimes this rock salt and other types of salt. Jivanti, Jangalamaush, those terms. That is Ena, Lava and Godha. Rohit, Matsya is good. Gogrut, cow's ghee. Godugdha, cow's milk. Best rasayana, best rasan, best tonic for the human being. Tilataila, sesame oil. Shunti, Deepana Pachana, ginger. Draksha, grapes, fruits, best. Sharkara, etc. Only this is not finished, etc. You can add more. Apathya, which is bad. Yavaka, mash. Why mash? Sir, black gram is bad? No, it is heavy for digest. So only digestion, pitta people can take. Vata cannot take. Vatula, they can provoke the Vata dosha. Nadi Jala in Varsha Rutu. You know, always in the rainy season, there is a contamination of the water. Always cholera, typhoid, jaundice, Ushara, Sarshapa, Go Mansa is bad. Mahesha Vasa, Chilchima Matsya, Avikshira, and Avigrita is also bad. Kusumba Taila, Fanita, etc. I'm sorry, my dear friends, some words are on those days, and I'm not able to discuss this time because we have the less time. I will focus on the important topics. Okay, let us move further. Now, here you can see. First, we will discuss about Charaka. I'm sorry, I will try to mark a little bit. Good. Yes. Fantastic. Ahar Varga. Shukha, Shami, Maunsa, Shaka, Phala, Harita, Madhya, Jala. Varga means groups. Varga, write down. Varga means group. Shukadhanya, as I have told you, grains. Rakta Shali, Shali is rice. Shashtika, Yava, and Godhuma. Godhuma is wheat. Gahu ani Tandul, Marathi Madhe. Shamidhanya, all the pulses. Green gram, Mugachi dal, Mudga, Masha, black gram, Kulat, horse gram, Teal, Adhaki, Masur, Chanaka. Mausa Varga, both. Anupa means where rain is heavy, and Jangal where rain is very less. Aja Mausa, Kukkutam. These are the things that are categorized in that group. You will have to learn the property of each substances by referring your own purchased textbook of Swasthavritta. Everything Dr. Deshpande is not going to tell. You have to remember all these groups. Okay? Kukkuta mouse, chicken, go mouse, matsya mouse, fish, shaka varga, patul, karavellaka, kashmanda, vrantaka, sarshapa, shigru, and methika. These are the names. But nowadays you can have all the names of the vegetables. I will discuss when the time permits. Phalavarga, fruits, grapes, draksha, dadima, pomegranate, kapitha, jambu, jamun, amra, mango, and bilva. Harita varga, ardraka, that is, what is ardraka? Wet ginger. Mulak, radish. Please write down, radish. Palandu, onion, and lashun, garlic. Madhya varga, sura, varuni, asava, and arishta. Jalavarga, Ganga Ambu, Samudra Ambu, sea water, Divya Jala, and Bhauma Jala of the rivers and the ponds and all these things. Dugdha Varga, Go Dugdha, cow's milk, Mahish, buffalo milk. Aja, dugdha, avidugdha, ushtri dugdha, hastini dugdha, ashwa, horse. Stri dugdha, breast milk is the best milk, breast food for the first 6 months of the life to the children. Takra, buttermilk, and ghrita, that is ghee. You have to read all these substances from your own Swasthavritta textbook. If you have any difficulty, just WhatsApp me. Ikshu varga, ikshuras, sugarcane, fanit, sharkara, sugar. Prutanna varga, as I have explained, manda peya vilepi. Manda is a rice with a lot of water, and rice water. Manda is rice water. Peya, very liquid type of the rice, and vilepi is a soft rice. So water percentage is less. But manda peya vilepi is very, very important for all the time in your life after panchakarma. Samsarjana krama. Diet advice is given on the basis of manda peya vilepi. Then yodana, yusha, saktu, and mausarasa. Ahar upayogi varga, that is spices, shunthi, ginger, pippali, long pepper, marich, black pepper, hingu, asafoetida, sendhav, and triphala. Okay. Now, I'm sorry. Sushruta has explained. Just kindly give me few seconds. Okay. According to Sushruta, Dravadravya Varga, liquids, beverages, and Annadravya Varga. What is included in Dravadravya? Jala Varga, water, Shira Varga, milk, Dadhi, curd, Takra, buttermilk, Ghrita, ghee, Tail, oil, Madhu, honey, and Ikshu Varga, sugarcane. Madhya Varga, alcohol, liquors, and Mutra Varga, urine even. Annadravya Varga, Shali Varga, Kudhanya Varga, Mudgadi Varga. Mudga means green gram. Mausa Varga, Phala Varga, Shaka Varga, vegetables, Pushpa Varga, Kanda Varga, tubers, Lavana Varga, Krutanna Varga, Bhaksha Varga, and Anupana Varga. So you have to just remember first these important terminologies. In all the subjects of Roga Nidan, Balarog, Komar Vritya, Sri Roga, Swasthavritta, first try to understand Ayurvedic terminology. Okay. Now I will move on this side and let us what we come across with the modern knowledge. Okay. I think we have back again, go a little bit down. Okay. This is again the Sushruta Taila Varga, Tila Taila, Sarshapa Taila, Madhu Varga, honey, Makshika, honey, Brahmara, Shaudra, and Paitika. These are the types of the honey. Kanda Varga, Vidari Kanda, Varaha Kanda, Shringataka, and Surana, yam. इसको yam बोलते हैं इंग्लिश में. अभी modern चालू हो गया. Now we will start a glimpses, trailer of modern. Nutrients. What are nutrients? Are organic and inorganic complex substances contained in the food which are necessary for the body growth. Number one, body growth, development, and maintenance of the body tissues. Nutrients are divided into two major categories. Here you can see, this is classification is important. Macronutrients, which are having bigger size, that is proteins, carbohydrates, and fats. Can you see here? And micro vitamins and minerals. Okay, let us discuss one by one. First, we will try to see here. Just wait, my dear friends. Now you can see very easily. Proteins. Proteins are complex organic substances containing the carbon, hydrogen, oxygen, nitrogen, and sulfur. These are the molecules in the protein substances. Proteins are always very good in the, please write down, pulses. Pulses. Proteins are best in pulses. Green gram, black gram. Green gram is the best. Soya bean proteins. Milk, best protein. Remember, proteins. Soya bean, milk, even non-veg, chicken having the proteins. Okay. Their smaller units are amino acids. When we consume the polypeptides, polypeptide is a long chain of these molecules. And when we digest with the enzymes, we cut this long chain, and final product is proteins are converted to amino acids, and amino acids can be absorbed through the blood. from the intestine, the villi. First year physiology. Please open the book, first year physiology, modern, and you read the digestive system. Please read the digestive system. Which are enzymes in the gastric juice, intestinal juice, pancreatic juice. You read that. Then you will understand these amino acids. Carbohydrates are made up of carbon, hydrogen, and oxygen. Here you can see 1, 2, 3, 4, 5. Here only 3, such as sugars, that we take sugar substances, starch, and cellulose. They are rich source of energy. Whatever we eat, chapati and rice, are basically carbohydrates. Okay. Then fats are made up of triglycerides and fatty acids. They are solid at room temperature. Now we will go further. Okay, we will see the nutrients, sources, and deficiency. But these deficiencies, all the diseases can be asked separately as a SAQ. Okay, even these are very common questions in the oral. Proteins are available in the egg, especially the white part of the egg. Yellow part is more fat. So those having the problem with the cholesterol, they should not take the yellow part of the egg. Please don't take the yellow part. Then milk, proteins are good. Meat, fish, pulses, cereals, and nuts. Okay. What are the deficiency? Protein, when especially undernourishment problem. PEM, protein, energy, malnutrition. Protein, please write down PEM, protein, energy, malnutrition. Protein, energy, what is energy? Carbohydrate. When the proteins and carbohydrate both are less, then the disease is marasmus. Marasmus. I have already uploaded 5-6 videos on the pediatric problems or regarding the pediatrics. I have already in your list of the Kaumar Bhrutya Tantra classes, there are a lot of videos. Please see each video very carefully. I have explained what is marasmus. I have explained what is kwashiorkor. I have explained the symptoms. Please look that videos. Otherwise, you will not understand this. Okay? And kwashiorkor is only protein deficiency. When protein and carbohydrate together deficiency, marasmus. Are you getting? Okay. Carbohydrates, what is the deficiency? Carbohydrates that we get from the sugar, wheat, rice, ketosis, and hypoglycemia. When the sugar is low, that is called as a hypoglycemia. When sugar is very, very high in diabetic patient, that is called as a ketoacidosis. Okay. Fats are present in ghee, butter, meat, fish, milk, oil, invisible fats in the pulses, nuts. Nuts, what is nuts? Cashew nuts, almonds. These are all the dry fruits. Then, because of the fat deficiency, you suffer from the phrenoderma. Phrenoderma. Derma is the skin. Phreno, dry skin, toad skin. Okay. Now, vitamin A. It is also called as a retinol. Okay. It is present in the animal liver, fish, milk, cheese, butter, leafy vegetables, and carrots. All the colored substances are rich in vitamin A. And if you have the deficiency of vitamin A, you suffer from the eye problems. Can you see? Xerophthalmia. Ophthalmia is the eye, regarding the eye problem, like night blindness. You cannot see in the night. Bitot spots, typical spots will be there. Bitot spots on the conjunctiva of the eye. Okay. Let us move further. On the next page, I will move the screen on the left side, and then I can again, if possible, but it is not necessary. I think it is very clear for you. But just okay, no problem. I will mark it. Now we are seeing these things. Colored cinema is there. Vitamin D. This is also related with the kidney. So it is also available from the sun rays. So milk, egg, liver, fish, liver oil, and basically here bold you can see sunlight. So early morning sunrise, early morning sun is not 12 noon sun. It is only at 8 a.m., 9 a.m. You can work in the sun, and you can run with the sun, walk in the sun. That is, the sun bath is very good to get this vitamin D. Then if you don't get the proper vitamin, rickets in the children and osteomalacia in the adults. These are the diseases of the bone weakness, bony weakness. There may be leg pain, backache, tiredness, joint pains, etc. Vitamin E, that is called as a tocopherol. Another names, always remember these synonyms. Paryay naam, different names. Vegetable oil, sunflower oil, egg yolk, yellow part, and butter. If you get less vitamin E, then you may suffer from hemolytic anemia. RBCs will break. Anemia, less hemoglobin. RBC count will be less. But vitamin E is also related with your energy, is also related with your immunity, and is also related with your, especially, please write down, vitamin E, infertility, वंध्यत्व, बच्चे नहीं होना, इसके लिए कई कबार ये विटामिन ई सप्लीमेंट करने की जरूरत रहती है. जिन कपल्स को इनफर्टिलिटी का प्रॉब्लम चल रहा है, लेडीज को हम विटामिन ई भी सप्लीमेंट तरीके से दे सकते हैं. विटामिन के is called as anti-clotting. Whenever there is a bleeding, we have to stop the bleeding. So K1 is present in vegetables and fruits. K2 synthesized in the bacteria in the intestine. So our intestine should be of good quality. So vitamin K is helpful to stop the blood, to stop the bleeding. Whenever there is a lot of bleeding, then injection vitamin K is also given by the general medical practitioner. Okay. Vitamin B1, thiamine, whole grain without polished type of the grain, cereals, rice, wheat, gram, and yeast. Vitamin B1 deficiency is called as a beriberi. My dear friends, please see the video, pediatric problems in GP. There are 6-7 videos, fantastic videos, and they are all helpful for this Ahar Varga. Okay, don't forget to see my videos. Don't each and every video in my playlist of Balarog or Ahar Varga. Then vitamin B12, riboflavin, sprouted grains, green vegetable, milk, egg, liver, and kidney. Then when B12 is less, deficiency, blurred vision. Your vision will be blurred, not clear. Dr. Deshpande, do dikh rahe mere ko. Why? Because you are not having B12. B12 deficiency is there. Blurred vision. Then cataract can happen and dermatitis. Cataract, Marathi मध्ये आम्ही त्याला मोतीबिंदू म्हणतो. It's a opacity of the cornea. Dermatitis, skin problem. B3 is niacin. It's present in the animal liver, kidney, animal kidney, meat, poultry, eggs, fish, and legumes. And in the deficiency of B3, you get the pellagra. These are all questions will be asked in the oral. Fat. B1 deficiency. Tell the deficiency of B1. Tell the deficiency of B2. Tell the deficiency of B3. They cut. फास्ट जल्दबाजी में वो पूछते जाएंगे और आपको फटाफट उत्तर देना पड़ेगा इन डेफिशिएंसी का, डिसीज का नाम बताना पड़ेगा. विटामिन B6, दैट इज पायरिडॉक्सिन, होल ग्रेन, लेग्यूम्स, मिल्क, लिवर एंड मीट. ओके. डर्मेटाइटिस ऑफ द आईज, then the mouth, nose and the mouth, all these regions will be affected. Next is a vitamin B12, that is cyanocobalamin. Only animal sources, milk, liver, kidney, meat, fish, and egg. In the deficiency of B12, you get the macrocytic anemia. This is very important. Please, I will give some time for this B12 deficiency. Please write down, very important. Megaloblastic, RBC size is bigger. RBC size are big. Megaloblastic, big RBCs. So they can break easily. Fragile ban jate wo. They becomes fragile. Red blood cells become fragile. Anemia is a less hemoglobin. Normal 12 to 14 gram per cent. Less red blood cells. Normal count 4.5 to 5.5 millions per cubic mm. 4.5 to 5.5 millions per cubic mm RBC. We are talking about B12. B12 absorbed from the intestine. But we are taking the B12, okay? But there is one problem. Write down. In the stomach, there is one protein. in the stomach, and that is called as a intrinsic factor. Intrinsic, intrinsic, intrinsic factor. If that intrinsic factor is less, then vitamin B12 cannot be absorbed, and that's become the megaloblastic anemia. Ayurveda has also said Ranjaka Pitta, please write down, Ranjaka Pitta is present in Amashaya, and that can be compared with the intrinsic factor mentioned by modern physiology. Shall I repeat? Okay. B12 absorption is taking place in the intestine. But for that absorption in the stomach, you will need intrinsic factor, that is one of the protein, RNTRNSIC. If that intrinsic factor is not there, then your B12 cannot be absorbed. So there is some reference of Amashaya with relation to the B12 absorption and the erythropoiesis. Sir, what is erythropoiesis? Write down. Formation of RBC, erythropoiesis. For that, iron is needed, B12 is needed, copper is needed, zinc is needed. For erythropoiesis, formation of red blood cells. So this is B12 deficiency. You can get a very easy B12 injections. Cyanocobalamin, Vitcofol. Please write down. Vitcofol, 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 pink colored injection. Patients are very happy. You just tell them, I am doing a fantastic tonic for you injection. 5 days course. 5 days course. Every day 2 cc in the buttocks. Vitcofol, please write down. Vitcofol, that is of B12, safe. But there is one injection which is having B1. So what is the problem? B1 is a very dangerous injection, good injection. When there is a tingling numbness in the hands and legs, diabetic neuropathy, we suggest injection, please write down, injection Neurobion, Neuro, Bion, B-I-O-N, Neurobion, Neurobion, Neurobion. Or, please write down, injection Polybion, P-O-L-Y-B-I-O-N, Polybion, Neurobion or Polybion injection. It contains, please write down, vitamin B1, B6 and B12. B1, B6, B12 together. Neurobion, Polybion. For what? Tingling numbness of the hands and legs. हातापायाला मुंग्या येतात मराठीमध्ये. हातापायाला मुंग्या येतात. बधीर होतात माझे हातपाय. That is maybe because of uncontrolled diabetes mellitus. Complication of diabetes. Diabetic neuropathy. This Neurobion injection, B6, B12, okay. But B1, OMG, oh my God. If you give the injection without testing, patient can die. OMG, oh my God. Patient can die because of the anaphylactic shock. Anaphylactic shock because of the B1. Anaphylactic shock because of the B1. So please, when you give the Neurobion or Polybion, AST, after sensitivity test, a little 0.01 ml give, see whether there is urticaria, unconscious fainting, don't give. So this injection, Neurobion, Polybion, should be given only after test dose. Okay. Then folic acid, dairy products like milk, liver, meat, fruit, cereals. This also can cause macrocytic anemia. In the pregnancy, iron tablet is given, and also folic acid is must for pregnancy. Folic acid is must for pregnancy. For pregnancy. Why? Because if it is not taken by the pregnant woman and it is a deficiency, it can cause the brain problem, neuronal problem, congenital deformities. So folic acid should be given to the pregnant woman in addition to the iron. In addition to the iron hematinics. Hematinic, you know word hematinic, which will increase the blood. In Ayurveda, loha sav. Loha sav. In modern, capsule utrin, AUTRIN. Vitamin C, ascorbic acid. It is present in vegetables, citrus fruits having the juice. Gooseberry, amala, lemon, okay? And if it is a deficient, then the person gets the scurvy, bleeding from the gums. Scurvy disease is there, okay? So now we will try to see on the right side of this page. Slowly we will go up. Yes, yes, it is present. So I will talk now about the milk. We will talk about milk, okay? All milk. This is all milk. Concentrate here, concentrate. Last 5 minutes. Okay. Composition of milk. Dugdha in Ayurveda, dugdha. Always the question is asked about milk. Carbohydrates are present. That is a typical sugar is present in the milk. Carbohydrate means sugar. Carbohydrate means sugar. The sugar present in milk is called lactose. Remember this, lactose. Sir, why to remember? In the practice, many people say, we don't take milk. Foreigners. Yes, nearly 80% foreigners don't take milk. Don't take milk. Never, never, never. OMG, oh my God, why? Because they say, sir, milk is only for children. Very misconcept. Then they also say, some people, okay, I can take, but I cannot digest. I cannot digest the milk. Whenever I drink the milk, I have a lot of gas. I have to go to the toilet. So that is because of some people don't tolerate this lactose. And that is called as, just a moment, I will check. Today's lecture is the best, too much to write. This is the feedback from one of the student. So don't worry, be happy. Slowly and steadily you can see the video many times and make the notes. Also, you can refer your own textbook of the Swasthavritta, whichever you have purchased. Okay. So lactose intolerance. Lactose intolerance. This is very common. So I will suggest what to do when the patient say, I cannot digest the milk. Simple trick. Simple trick. Take a lukewarm milk of 1 cup and add a pinch of dry ginger powder. Dry ginger powder. Very, very little pinch. Then try to drink for 15 days. Increase the quantity of milk. Pinch of, go on adding. And one day will come, oh doctor, now there is no gas. I cannot go to the toilet. I should not go to the toilet when I drink the milk. I'm happy. I can drink the milk. This is that. Lactose intolerance is a complaint. Composition of milk, now in the foreign countries, even the India, we get the A2 milk. Without fat, with fat, lot of types are there. Protein, which protein is present? Casein. Some people, they have the allergy of this casein also. Vitamins, all vitamins except vitamin C. Vitamin C is not present in the milk. Then ash minerals are also present. Milk hygiene. Hygienic condition during the milking, when you do the cow's milking, and storing of milk is very important to prevent the contamination. Now we always drink the pasteurized milk, so there is very less chances that you get the problem with the milk. Milk-borne diseases. Diseases caused by the milk contaminated. Bad milk with the bacteria, viruses. Some may get the typhoid fever. This is a fever which is going on more than 1 week. And if any fever, always remember, don't give the antibiotic on the first day or the second day of the your fever. Never. Never. That is bad habit. Give always symptomatic. Maha Sudarshana Ganavati, Ayurvedic. antipyretic to reduce the fever. This typhoid, when you want to diagnose, Vidal test is done. WIDL. Vidal test is done in the second week only. It comes positive only in the second week. But if you give the antibiotic in the first 2-3 days, then this test is of no use. Paratyphoid is also the fever disease, diarrhea, loose motions, cholera, both gastroenteritis, vomiting, and cholera is basically loose motion, rice water stool. Tuberculosis, lung problem, food poisoning. So now we do the pasteurization of milk. Short note may be asked, pasteurization. According to AWC means according to WHO, World Health Organization, pasteurization is defined. What is pasteurization? Heating of milk to such a temperature and for such a period of time that are required to destroy any pathogen that may be present while causing minimal changes in the composition, flavor, and nutritive value. That are kept as it is: composition, flavor, and nutritive value. Method: Holder method, HTST method, and UHT method. What is HTST? High temperature, short time. And UHT, ultra high temperature method. Okay. Now, the last few minutes of today's lecture, very last few minutes, you will be happy. 1 hour is going to finish. This is the last point. Food-borne diseases. Diseases caused by the food contaminated with bacteria, viruses, parasites, or toxins. Number 1, especially in the festivals, Ganpati Utsava. I am not against the Ganpati Utsava. I am not against any puja, worship. But at that time, when a lot of huge amount of food is prepared, chances, I am not saying every time happens, but chances are there that there may be flies and contamination may take place. So food poisoning is common in the festival seasons. Nausea, feeling of vomiting, nausea, rullas in Ayurveda. Vomiting is a chardi, diarrhea, loose motions, stomach cramp, pain in abdomen, gastroenteritis, inflammation of stomach and inflammation of intestine, both. So there will be, it is, in short, it is called as a gastro. Gastrochi saath haliye. There is an epidemic of gastro. So vomiting plus loose motions together, that is gastroenteritis. Then cholera, I think it is repeated. Okay, food fortification. Food fortification. What is that? It is the addition of key vitamins and minerals to your food, like iron supplements for the anemic patient, folic acid supplement, iodine, vitamin A. Iodine is for thyroid problem. Vitamin A and zinc, two staple foods to improve their nutritional content. Whenever the deficiency disorders are there, always your food is supplemented. So supplemented is nothing but fortification. You must remember this word, fortification. Last, adulteration. Mixing other matter of an inferior and sometimes harmful quality of food and drink intended to be sold. That is called as adulteration. Some mischiefs or some, what you can say, the bad people in the society, just because of the craving of the money, they do this type of the adulteration in the food, and this is a very serious problem. That's why you must remember the word FDA. Food and Drug Administration is department of government, and their supervisors, they are always at random visit to the shops, at random visits to the hotel, and check the food quality and their standardization. Okay. So my dear friends, this is all about the Swasthavritta lecture on 22nd of October 2023. We will meet in the afternoon on this today only, Sunday, because we have 3 to 4 Charak Uttarardha lecture. Thank you very much and take care, and see you in the next lecture. Thanks.